I think about I'm never really going to be a pediatric expert. I'm never going to be a behavioral health expert, although I've worked both at Boston Children's
Yeah.
and in behavioral health, mostly administratively.
Yeah.
And I'm old and I'm at the end of my career. I'm not in the beginning or the middle.
Yeah.
And I can give it a face that these are real people
Yeah.
that this is happening to. There's these, it's parents, it's young people, it's doctors, it's nurses, it's people, peer support.
Yeah.
These are real people doing real work
Yeah.
and just better understanding that real work.
Yeah.
So what do you think about my audience is really varied.
Yeah.
Patients, caregivers, clinicians, data geeks. So what do you think? What advice do you offer as people are struggling, learning, advocating?
Yeah.
What do you think?
Yeah. It's a great question. I think that the biggest thing, and I say this because I've had these experiences with my family, I just don't think people understand the degree to which this is affecting patients and caregivers and the care team, the providers. I say my family, I've talked to my brothers about this, and they're not, neither one is in medicine, and they just have no idea. They don't understand that in our emergency room, there were times in the last year where of our 45 bed main ED, 34 patients were behavioral health or psych boarders.
Oh
And
my God.
so you're then trying to, and so that clearly is a stressor. And then we've had record volumes with all of the various viruses that are going through flu and RSV and all these other things, COVID. And so we're now funneling these huge volumes through tiny spaces. We're creating offsite spaces to see patients that are not designed for emergency department care.